So now that we have draped our patient, we put the sterile cover on our ultrasound probe. It is in a position that it's not going to fall. Let's go through the equipment. I like to go through my equipment in terms of the order that I'm going to go through it. So the first step is to prep the area. So we'll need to get some lidocaine, and we can ask our assistant to drop it here, or we can have our syringe ready and just hold it in place. So what I'll do, then just get ready with the lidocaine. And in this part of the procedure, you can use your ultrasound cover to find your IJ, numb the area, and then go set up the remainder of your equipment. Okay? For the sake of this demo, we'll forego this step. Let's assume the lidocaine part now is done. So let's go through the equipment in terms of the order of how I'm going to go through this procedure. First, we have our needle and our syringe. Very importantly, make sure this is not tightly wound. The last thing you want to do is that you get the IJ and then you struggle with removing the syringe off. So that's good. So we'll have this ready. The second part, after you get cannulization and flashback, you want to thread the wire. So very importantly, this is your wire. We are removing the plastic white part, this part. We're not removing the blue part. So that threading the wire is much easier. And what you need to do is that just move the wire in and out, make sure that it's good, and then have it loaded and ready for cannulization. So this will be step number 2. So after you get flashback, after you thread the wire, the next part is that you're going to make a nick. So for your dilator. So this opens up, it's closed. That will be your third step. After you make your nick, the dilator comes back. I'm just going to speak because that's the way. So that we have the dilator. Now, the way I like to do things is that I like to prep my equipment. So let's grab the catheter. So let's grab our triple lumen. And then what we're going to do is that I like to cap the white port and the blue port. And the reason why I don't cap the brown port is that that's where the wire will come out. If you cap it, the wire will not come out. So you don't want to do that. All right, now that we put the 2 caps on, the blue and the white, what I like to do next is flush all the ports. And make sure all the ports are working. And watching for that fluid coming out. Okay. That's good. That's good. And then the last thing I do is that I get my equipment ready. I take the 3rd cap and I put it on my last sterile syringe. So that once I'm done with the procedure, I cap the brown port. So that's the order of stuff I set up, and then move on to get ready for the procedure. Now that we have done all of this, that gives us enough time for the lidocaine to take into effect, and you're ready to start.